Welcome to Get the Facts, the program that provides you with information on government's policies and initiatives. I'm Theodore Henry. For the next few minutes, we will engage in a vibrant discussion on Jamaica's expanded program of immunization, plus the flu vaccine and the importance of these safeguards to our health. Here with us to share more information on Get the Facts is Director of Family Health Services within the Ministry of Health and Wellness, Dr. Julia Rowe-Porter. Dr. Rowe-Porter, welcome to the program.
Thanks for having me, Theodore.
All right, let's jump right into getting some facts now. Immunization is used globally, and everybody has heard the word immunize, and of course things like vaccine and whatnot. So it's used globally to save millions of people, and it's definitely important to Jamaica's health strategy. Now, in the intro, I had mentioned the expanded immunization program. Can you tell us a little bit about what that program is and what it's meant to do?
Sure. So I have to go down memory lane.
Please.
About 100 years ago, not even so long, in the 1940s, the common illness of the day was infection. So a lot of infectious illnesses, including polio, measles, other vaccine-preventable diseases, were what was killing our people. That was our main causes of death, including children, and that was a travesty, where our infant mortality rate was 100 to 200 per 1,000 live births. When you work that out, that's, 1 to 2 children per 10 births, and that's really significant. That's awful. So with advances in health, including vaccination, nutrition, sanitation, there was control over these infections and frequent outbreaks. So you'd have a lot of outbreaks affecting children, and there were high death rates. And with vaccination campaigns, they eventually, over the decades, minimized the deaths and the disability until in the 1970s, the vaccination program became more organized. And in 1977, you had the expanded program on immunization being a major intervention at the international level. And in Jamaica, it was established September 1977.
Oh, so the expanded bit is coming from the more organized, the more...
Yes, that, and the expansion in the number of vaccines that were produced. So polio and measles were the main diseases of concern, killing our children, and of course smallpox as well. And so in the 1980s, the outbreaks became less. We started introducing new vaccines like BCG for tuberculosis, and then with time, there's rubella, diphtheria, pertussis, tetanus.
You know what's interesting? You mentioned a while ago things like polio and whatnot. I don't hear nothing about those anymore. But, but hold on. I want to ask something before we get there. You have underlined children in this line of thought. And as far as I'm aware, that usually for back to school, immunization is required. As the children have to be immunized. Now, how does this work for the parents out there?
So children are a major target group because they're a vulnerable population, because their immune systems are weaker than the adults, especially the newborns and the infants. Their immune systems are underdeveloped. So, I mean, even naturally, breastfeeding has antibodies that naturally immunize children to protect them. So children need to be protected. And we've found that vaccines have been very effective in stimulating their immune system. Persons would remember getting vaccinated in school because, yes, exactly. I got the BCG, the polio drops that the nurse used to come to school and give you, because even when before the program was established, schools were targeted because children congregated there. And when you have masses of people congregating in a space, then that is a ripe environment for diseases to spread and outbreaks.
I'm disappointed you didn't say super spreader.
It's a super spreader. Yes, so the schools were targeted.
Yeah.
And in 1986, the government of Jamaica thought it was so important to prioritize vaccination of children, especially in the school setting, that our immunization regulations were promulgated to protect our children. And we have made so many achievements since then, because we've seen the back of polio and measles. The last case of polio was in 1982. Last case of measles, locally transmitted measles in Jamaica was 1991.
Right.
And diphtheria, pertussis, tetanus, rubella up to 2001, because we have such a robust vaccination program that has really had high achievement. We've done so well that we've forgotten what these diseases look like. The doctors and nurses of today haven't diagnosed these diseases because we haven't seen them in decades.
And so this is based, there's a law governing vaccination.
That's
mentioned
correct. So the law says that all children under the age of 7 have to be adequately immunized for their age for registration to school. So if they are found not to be fully vaccinated for their age, then they should not be registered for school, and the school operators, parents, healthcare workers are liable if they allow children to attend. And this applies to daycares, nurseries, basic schools, primary schools, all children.
So these vaccinations happen prior to you attending school?
Yes, and they're given from birth. So BCG, hepatitis B are given at birth in the hospital. And then in infancy, 5 other antigens or vaccines are given at 3 months, 6 weeks, 3 months, and 6 months. At 1 year old, you have another set. MMR is given at 1 year old and at 18 months, and then you get booster doses at 18 months, and then prior to entering primary school, you get another set of boosters.
Right.
And there's another booster that is given before high school, which is diphtheria, diphtheria, tetanus, and we've introduced HPV, human papillomavirus, as well, which we give to children. So it's the whole span of children from birth to pre-adolescence, adolescence. We have to ensure that all of them are up to date based on their age.
You know, there's a question I want to ask, but we have to break. We have to break now. So I'm going to come back right after the break. You don't want to miss this. Please stay with us.
Mosquitoes will breed in containers that hold water. Tightly cover water storage containers such as drums, buckets and tanks, or cover the water surface with cooking oil. Punch holes in all tins, plastic containers and boxes to prevent the collection of water before disposal. Cover old tires or fill with dirt. Scrub all vases once per week to remove mosquito eggs, and dispose of garbage by placing in plastic bags. Do your part to prevent mosquito breeding. A message from the Ministry of Health.
Welcome back to Get the Facts. We are continuing our conversation with Dr. Rowe-Porter, Director of Family Health Services at the Ministry of Health and Wellness. We're discussing Jamaica's immunization program, plus the protection we can get from taking the flu vaccine. Doctor, continue the thread that we were on just before we broke. You were listing out how vaccination happens throughout childhood, and somebody's asking the question, what if I miss?
That's a good question. Now, there are several opportunities to get vaccinated. Well child visits, one of the main focuses of the visit is to get the vaccine. If you miss, you can go back to the same facility or any facility.
Right.
And say you missed it and you can catch up. You don't have to repeat, you just have to catch up. And it's important you get your vaccines on time, because the earlier you are fully protected, then the more protected you are. I mean, if you delay your protection, then you're more vulnerable if we get an outbreak, God forbid, of any of these diseases. And we want to ensure that our target of 95% is met, meaning of 100 children.
Our target?
Yes. Of 100 children, we want at least 95% of them to be vaccinated. Jamaica, you know, we like exceeding at everything, so we aim for 100.
Right.
But there are few children whose immune systems are weak and may not be eligible for vaccination for medical reasons, so we have to protect them. So they will be in those few that can't get vaccinated, and it's the rest of the population that has to be protected to protect them, and that's called herd immunity.
Right.
So it's important that as many children as possible, most if not all, are vaccinated if they're eligible, so that we can have that herd immunity. Okay,
so that target, I'm sticking on target, that 95% you laid out, is that a 95% of children, or is that a Jamaica-specific immunization target?
So it's for children, but of course, as they grow older, because that immunity lasts a lifetime for most of the vaccines. So if all our children are vaccinated with decades, then our entire population will be immune, and that's how we can keep the diseases out and also prevent the spread in the families. The children will come home and the parents will be exposed to the other members of the family. So our whole population is what we want to protect, but the children are at risk of the most vulnerable outcomes. We start there as well.
Okay, so 95% is our target. I have got to ask, how are we doing in terms of that target?
So we were concerned during COVID because, you know, when you're in emergency mode, the resources are shunted to dealing with that emergency, and that may have caused a shift from the routine program, and some access to care may have been affected. Our target, we didn't meet our target for most of our antigens, is what we call them. In 2021, we were in the 80s. And you may say, oh, well, that's not so bad. It's just like you're doing a test. 80s is like an A and not an A+. But it's important.
Yes.
Because say you have a school of 100 children, and your coverage is 80. 20 of your children are not fully immunized. It means if you get one of those diseases in the school, if it's introduced, then you can have an outbreak.
Yeah, 20 is significant.
20 is significant compared to 5 or 2 or 1. Right? So if we are not careful and not vigilant to close that gap, then we're going to be in trouble. Well, yes, we are. This year we had a catch-up vaccination program starting late last year into summer. And, you know, school medical season is in the summer where, you know, persons are getting their medicals to go into school. And we use that as an opportunity to engage parents and ensure that they take their cards in and that their children are up to date. And if they're not, then we vaccinate them. So we see trends that we are meeting our we're closing that gap. We're pretty good on our targets so far. We're grateful to Jamaica for responding and seeing the importance of vaccination.
Right. I've got 2 more questions for you. I'm going to try to crunch them down as tightly as I can. We're about to enter flu season, and I understand government provides flu vaccines yearly as a safeguard.
Yes.
And who should get the flu vaccines and why?
So influenza you may think of it as, oh, just a little cold, you can just get it, the disease instead of the vaccine, but influenza can be pretty serious. It can cause severe illness and death, especially in vulnerable groups like young children, as well as elderly persons with chronic illnesses like heart disease, diabetes, weakened immune systems, healthcare workers as well that have to take care of ill persons.
Lots of exposure.
Lots of exposure, and they can pass the flu virus onto their sick patients. So we target those vulnerable groups during the flu season, which starts about October and can last into next year as late as May. And we ask that those persons go to their health centers. The flu vaccine is available at all vaccination points, over 300 across the island. And even some hospitals, of course, you know, they have clinics so they can get the vaccine at their chronic disease clinics. And ask for it. It's available. We target those priority groups, but I mean, I don't think we'll turn away someone that really wants to get it. But we target the vulnerable groups. We also target frontline workers like our police and our soldiers that are working on the front line to protect us. So that's our essential services stand up in the flu season. Now you don't have a lot of absenteeism and a lot of illness in our key services.
All right, so Dr. Rowe-Porter, we're in the final moments of getting the facts, and I'd like you to close us out with, it's a question from me, but it's probably a testimony from you.
Okay.
All right, you mentioned several diseases that we've seen the back of. You know, in the final few seconds, can you just speak to the efficacy of immunization and how important it is for us to be on board?
Okay, so we are victims of our own success, meaning we've done so well as a country. We've gotten international awards for our program, and it's to the point where we've forgotten what these diseases do. We can't slip and slide and say, well, what's the point? We're not seeing them, let's not get vaccinated, because if we do, then we'll go back to the era where we're suffering from these deadly diseases. So Jamaica, if you need information, if you want to know more about why and if you need to get vaccinated, then talk to a healthcare provider, go to a credible source, and know that we are on track to protecting our country. Vaccination is a very cost-effective and safe intervention. It's worked for years, and we want to protect Jamaica and maximize our health through vaccination.
Remember to check your child's immunization status and ensure they are fully immunized for their age. Based on what Dr. Rowe-Porter just said, it's not just you, it's about everyone. So your children are important, family members are important. Get the facts about immunization and vaccination out there in your life. This has been Get the Facts. Our guest has been Director of Family Health Services in the Ministry of Health and Wellness, Dr. Julia Rowe-Porter. Thank you for watching, and until next time, I'm Theodore Henry. Take good care.